All right, this is not going to seem real mathematical today, but I just feel like we can't talk about collecting data without talking about a little ethics. So, anytime you collect data and you're dealing with human subjects and people, data ethics are going to come into play, and you have some things that you really need to think about. Okay, so we're going to just spend a day on this, even though it doesn't feel real mathematical. Um, are sham surgeries ethical? You can read this, but sham surgeries are like placebo surgeries. They are fake surgeries, and if you want to hit pause and turn this off, you can. Um, in class, we are going to discuss whether you think sham surgeries are ethical or not, and it is totally up to you, but typically what happens is some people think it is very ethical to do placebo surgeries because of the placebo effect being possible, and it is the best way to offer a control group for surgeries to see if they are ethical or not ethical. On the flip side of that, people feel like there's an awful lot of risk doing a surgery that is kind of not actually done. There's always risk with anesthesia. There's always risks of infection anytime you open anybody up. The extra medicine, the recovery that has to happen when you do a fake, when you have a surgery, even though you don't get the full surgery. All of those things, people on that side of the fence feel like sham surgeries are unethical. So you have to kind of decide. Um, the thing that sometimes makes people sway one way or the other is knowing that people who are going to possibly have a sham surgery do have to sign a consent form saying, I know I may have a possible fake surgery, but I am willing to try it anyways because I just want to get better. And then if people know that they have signed a consent form, sometimes they think that sham surgeries are ethical. I'm sure for many of you, you would question what type of surgery it is. You know, if it's maybe a surgery to remove, something minor or whatever, then it seems ethical. But if it's something major like open heart surgery or something like that, then clearly people would think it's unethical. So I don't know what the right answer is, and people in science don't necessarily know what the right answer is either, but they do exist, and there is an argument out there in the scientific world about whether sham surgeries are ethical in the name of science or not. So you can kind of decide for yourself, but you can read this and then get your own opinion out there. All right, then again, um, I want you to hit pause and read this little article. I'm not going to read it to you on here because you can read, but hit pause. And you can see that this study was very controversial, obviously. Basically, what they were doing was because they wanted a complete control group, they were withholding a known treatment that works out there. And this was a major problem in society, and it is still kind of being played out today, although it's getting long enough ago now that it's a little bit better. But for a long time, black people would be very reluctant to participate in any scientific studies, medical treatments, whatever, medical trials. And it is largely because of this Tuskegee syphilis study where blacks were withheld treatment of a known treatment to treat their syphilis in the name of science, and that was not okay. And so they have changed the laws and the restrictions about that since then, and this would never happen today. But it was a problem then. And so basically what you need to know out of this is that it is absolutely unethical to withhold a known treatment just to have a control group. That doesn't work, okay? Um, so that's where we're at there. All right, and then when you participate in clinical trials or behavioral kinds of trials, any kind of trial, you need to sign a consent form. That just in the consent form is things like how much time it's going to take, what's your commitment to it. This is what you're going to have to do if you agree to be part of our study. These are the potential risks that could happen if you agree to be part of our study. All of those things are in the consent form. However, um, there are times when people can't consent, and I want you to hit pause and read this. And so sometimes even just the fact of whether you can get consent from people or not is controversial. Okay, children can't fully give their consent, so I want you to think about, oh my gosh, I have a 16-year-old. They're under 18. They really want to have gastric bypass surgery because they're really heavy. They're willing, they're ready, they're going, whatever, but they can't sign their own consent. Only their parents can. Should that be okay? Not okay? How does that work? So there's lots of cases where consent is maybe not given, but maybe it's unethical to not give treatment even though you don't have consent. I don't know. It's really great. Think about it. Whatever. If you had an emergency situation, someone came into, the ER having some heart issue, and there's this new trial that you're trying to do on heart attack patients, and then it's hard to get consent from them in an emergency situation like that, but we want to try this, whatever. Is that ethical? Not ethical? Whatever. Okay. All right. There's a drug that is known to be quite effective in treating a medical condition. A new, more improved drug is being developed. Is it unethical, or is it ethical, to conduct an experiment by giving one group the new drug and one group the placebo? And again, no. You might think it is ethical in the name of science to have a good control group to compare it to. It's the best scientific method is to give one person nothing and the other person the new drug. However, again, it is unethical to withhold a known treatment. So your control group in this kind of case would have to be that you would give one drug, one group the old drug, and then the other group could either be the old drug with the new drug on top of it, added to it, or one group the new drug. But you can't give one group the new drug and one group nothing. Okay, so that has to happen. That's the ethical standard in medical trials today. All right, anytime you do clinical or behavior, any type of experiment on human subjects where you're involving them in some sort of a study, whether it's a medical study or a behavioral kind of study, which we'll talk about in a minute, there's three things that absolutely have to get done. The one thing that you do is you get approval from a review board. And this review board is typically at colleges and universities because they're typically the ones that are doing cases. I know in Minnesota there's a review board at the University of Minnesota, and there's also one at Mayo Clinic. I know that for sure, and there's probably others, but I do know that there's review boards at those two places. And basically what you do is you submit a proposal for your study, and you say, hey, I want to do a study about, this is what I'm going to do to carry that study out, this is how long it's going to take, this is what I'm going to ask my patients or subjects to do, and you lay all that out for the review board. And then that review board kind of asks the question, do we think the risks are small enough for the subjects participating in this study for a big enough potential gain in future treatment? And if they think the risks are small enough and could really benefit the rest of society in general, they would approve that study, okay? If they think the risks are just simply too big, they will say, nope, you can't do your study, okay? And your study has to be approved in order to conduct the study, or you are in legal trouble. So you have to get approval from a review board in order to put human subjects through a trial like that. Then you need to get the subject's consent when at all possible. We've already talked about situations where it's sometimes impossible to get consent in an emergency kind of situation, or a person who's mentally challenged or whatever. But when at all possible, you need to get the patient's consent. And again, in the consent, you have to lay out for the patient, here's the trial you are signing up to be in. Here's the risks. Here's the time commitment from you. Here's what we're asking you to do. These are the rules you will have to follow, blah, 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 blah. Okay, and then yes, I agree to it, or no, I don't agree to it. And clearly, if they don't agree to it, they don't get to be in the study. Okay, and then you need to obviously keep the results confidential. So when you report the results, you can't report them saying, Chris Tobratz, got this on her, this is her weight and this is her whatever they're studying, I don't know. But you need to just report results in a way that can never be tied to a specific subject, okay? Report group results, but not a specific subject. People always ask at this point, well, don't people get paid to participate in these clinical trials? And sometimes you do, but honestly, the way it's leading more towards the sort of the standard now is that you don't get paid, but you also don't have to pay to receive the treatment. Sometimes you do. Sometimes it still gets billed through your insurance. But oftentimes what it is they will give you that treatment, but then you don't have to pay for that treatment. And sometimes you do. I know my dad has cancer and has been part of a clinical trial. And his still got billed to him. And that's just kind of the way his was. But it just sort of ranges depending on the trial and how it's funded and all kinds of good stuff. Sometimes you do get paid, but very rarely anymore. Usually you just get the treatment for free, and sometimes you even still have to pay for it. Okay, and again, it's not ethical to withhold a known treatment and give just a placebo. All right, 2 words you need to be familiar with: confidential. And that's where you report the results. So you can say, 52% of my people, da 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 da. But you have to report them in a way that no information could be tied back to an individual subject, okay? And that's how that has to work. And then anonymous means that you conducted a study, but their names were never known. And this is really, really rare. You have to, almost always, you have to know names so that years later you can go back to them or whatever. And clearly the blind and double blind thing comes into play here too. You don't want people to know what treatment they're being given, but somebody somewhere typically has to record a name, even if it's not the person actually receiving the treatment or giving the treatment. Someone, some secretarial or managerial kind of person somewhere usually has to record a name and results with that specific name so that they can go back to those people if necessary. And so it's very, very rare for a service to be anonymous. Sometimes you think it might. Sometimes you might get something in the mail saying, fill out this survey and send it back, and you think it's anonymous. But on the back of that survey is probably a barcode, which is probably tied to your name or address. So they might make you think it's anonymous when it really probably isn't. But once in a while it is. All right, then you can watch this YouTube video. I'm not going to pull it up and take the time on here to pull it up, but go to this link and check out this YouTube video. It is about an experiment, a very, very famous experiment. You've maybe watched it in other classes, where they were trying to see if people would give in to peer pressure, basically. And so what they did is they brought some subjects in, and they were giving them a memory test, saying, memorize this list or whatever, and they had to answer the questions on it, and then they had someone sitting behind a shocking machine or whatever, and if the person got it wrong, the answer's wrong, they were to shock that person. They were to give them a little shock. And the more they got wrong, the more the shock intensity increased, okay? And so they were just trying to see how long these people would go and keep pressing the shock machine under peer pressure. Okay, so they would say, oh, shock them. You just have to shock them. That's part of the rules of the experiment. You have to shock them. And they were trying to see how far they would go. And everybody else was faking it. The people giving the peer pressure knew what the experiment was about. The person answering the questions knew that it was fake. And everyone knew it was fake except for the person giving the shock. And it was kind of controversial, and they had to lie to them. They didn't tell them it was about memory. Or they told them it was a memory test, not a peer pressure test. So they had to lie a little bit about what the experiment was about. You should read it or watch the video. It's kind of interesting. But that brings up some other things that we need to talk about, and that is anytime you're studying human behavior, things like, do people lie? How do people treat each other? Will they cheat on a test? Will they, all those kinds of things, ethical, behavioral kinds of things. Again, you still need to get consent from patients to participate in a study. The hard part about this is that if you tell people, hey, I'm going to do a study and see if you will cheat on a test, guess what? If they know they're being observed, they're probably not going to cheat. So it is really, really hard when you have people sign a consent in a behavioral kind of trial for them to behave authentically. And so you kind of have to work around that a little bit, but you still have to give them consent unless you are just simply observing in a public place. Sometimes you need to lie to them in that consent, though. I can't tell you I'm going to study, whether you cheat or not, or you won't behave authentically. So I might need to tell you I'm studying something else and lie about it and get your consent about that. But in the end, I'm going to need to tell you, hey, guess what? You just experimented on something different, and I'm sorry, but here's what we really did, and you need to explain it to them as soon as possible afterwards. And then in your consent, when you do that, you can't hide any information that might influence the subject's willingness to participate. So, you can't, like in that shock experiment, I couldn't avoid telling them, hey, you might be shocked, or you might have to give a shock, because that would be, some people just couldn't handle either receiving it or giving it, and that just wouldn't work, okay? So you can't withhold anything that you think would make them not participate. All right, then, these are some examples of some different situations, and there is not necessarily any right or wrong to some of these, so we'll just kind of talk about it. The presidential election is in full swing, and candidates have hired organizations to take regular polls to find out what the voters think about the issues. What's required in informed consent. Okay? And again, anytime you talk about what you need to talk about in the consent is what your responsibility as a participator is, what your risks would be, what the rules are, how much time it's going to take. Those things need to be in the consent. Why is it required to give the name and organization of who is carrying out the poll? Again, you want to know that it's a neutral party doing it. People that might be influential in whether they participate or not. So if it's not a neutral party, they may or may not participate. So you really need to do that. And would revealing the sponsor bias the poll? It absolutely could. Absolutely. And should the sponsor always be revealed? Yes, they should always be revealed, because we don't want it to be biased. We want it to be transparent and honest and truthful. Is it ethical to require prisoners to serve as experimental subjects? Or how about charity medical patients, meaning patients that can't afford any care at all? If we said to them, the only way we'll treat you is if you be part of this study. And I will tell you kind of the gold standard out there in clinical trials right now is that no, neither one of these are ethical. They used to do both of these things a lot, and they have sort of put a kibosh on it. How about students requiring to participate in an experiment for a grade in a class? And that one is a little bit gray, I would say. But again, and you can have your own opinion on that, but the gold standard kind of out there is that anytime you have a dependent subject, like a prisoner patient or a charity medical patient or a student in a class who just wants a grade for the class, it's considered unethical to require them to participate in a study. All right. And then a psychologist measures the attitude of subjects towards cheating and has them play a game rigged so that winning without cheating is absolutely impossible. The computer that organizes the game also records whether or not they cheat, but the subject doesn't know this. And then attitude towards cheating is retested. Subjects who cheat tend to change their attitude and find cheating more acceptable after they take this experiment. Is this ethical or not? Your opinion. Totally your opinion. Some people say no because they lied to them. Some people say yes because they had them sign the consent and everything's fine. Nothing, it didn't damage the person's character at all or whatever. You decide. Most people would probably say this is ethical, but some wouldn't, and if you can defend your answer, that's great. Okay? So that should do it for homework tonight, and away we go.